Minoxidil or Finasteride?
Minoxidil versus Finasteride versus Redensyl.
So anybody who has decided they're not interested in minoxidil, maybe because you've tried it, it didn't work, it's too irritating, or you're just simply not interested in minoxidil.
Are you suffering from hair thinning or hair shedding?
If you're experiencing any type of hair loss, then minoxidil may be for you.
और आप सोचते हो कि पता नहीं minoxidil लगा लें, will that be enough? Or should I risk the side effects of Finasteride? Or the latest thing, Redensyl is here, should I try Redensyl? You are in a lot of confusion. Various people talk about various things, but today let us discuss on this platform Mintalk versus Finasteride versus Redensyl. By the end of this video, you'll be able to make out for yourself whether you should go with Minoxidil or Finasteride or Redensyl and how you should start with them so that you avoid the common mistakes which delay the hair growth. Do not forget to subscribe this channel for more such educational and informative videos. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon. We've been doing hair transplants at Saraswat Hospital Agra for more than 2 decades. We've been training doctors in the field of hair transplantation also for past more than a decade now. We have trained doctors from more than 30 countries and we have seen hundreds and thousands of patients for hair loss, giving them medical therapies, medical treatments, making them understand and moving along with them in their hair loss journey, holding their hands so that they know what is to be done and when. Do not forget to press the like button. Before we actually compare them on various parameters, let me give you a quick introduction regarding Minoxidil, Finasteride and Redensyl. Now, what is Minoxidil? Minoxidil is a US FDA approved solution for female and male pattern hair loss. Since we are talking mainly about male pattern hair loss here, Minoxidil can be your choice as a solution to put on your scalp. Now it is available in a tablet form also. So it is available over the counter. It may have itching or redness as a side effect. It is not exactly a DHT blocker, but it improves the blood flow to the scalp and it helps bringing the sleeping hair into the growing hair phase. But wait till the end because maybe Minoxidil is not the drug of choice for you. Now coming to Finasteride. Finasteride is a US FDA approved DHT blocker. We all know that in male pattern hair loss, the major culprit is dihydrotestosterone, which actually miniaturizes or thins out your hair diameter because it clings to the root of the hair which has DHT receptor, and after making it thin, it gradually sheds it off so that you see bald patches of a patterned hair loss on your scalp. The direct effect on DHT is by Finasteride. But wait here, Finasteride can have its own set of side effects. People are very much afraid of the sexual side effects which it may have. Though a very less number of people are affected, but still it's in the mind of many of them and therefore people are usually worried to start this drug. Now coming to Redensyl. Redensyl is a plant-based derivative. Minoxidil was synthetically made in the lab. Redensyl is a plant-based derivative. Usually it is made up of EGCG2, dihydroquercetin glucoside, glycine and zinc. Its main mechanism of action is that it stimulates the growth centers of the hair follicles so that they grow well. It has fewer known side effects and it is very well accepted because it's a natural derivative with very few side effects. Research is not as much on this compound as it is on Minoxidil and Finasteride. So it may be good for beginners or those who are afraid of the side effects of other drugs. Now let us compile this information in a tabular form. You may take this screenshot so that you can refer it to whenever you feel like. So we'll be comparing our Minoxidil, Finasteride and Redensyl on 5 parameters: effectiveness, side effects, ease of use, cost and who should use. Talking about effectiveness, Minoxidil is effective in increasing the blood flow to the scalp and it makes the dormant hair or the sleeping phase of the hair go into the emergent phase. Finasteride is a DHT blocker. So it properly blocks the DHT formation and therefore it decreases the miniaturization and improves the hair. Redensyl is not so much researched upon, but it is well known that Redensyl directly acts upon the germ cells of the hair follicle. It improves the germ cell condition, the dermal papilla, and improves the hair health and diameter and the growth of hair. Coming to the side effects. With Minoxidil, we know that it may cause irritation, redness, flakiness, itchiness. Sometimes people come and say, doctor, my hair became tight when I put Minoxidil. But then the Minoxidil is to be put on the scalp by the dropper. This will decrease the tightness. But still, redness, irritation can be there, especially in the beginning. Now, Finasteride is much feared as a drug if the sexual side effects are taken into consideration, which are very less in number. In most of the cases, they are reversible, but they are still there. So before actually starting your Finasteride, you need to talk to your hair doctor, get a proper consultation so that you understand the various side effects and how to tackle them if at all they occur. I think we have a very good video on Finasteride and its side effects, the link of which I'll definitely give by the end of this video. Side effects of Redensyl are not much. It's a naturally derived compound, and still some people may feel slight irritation or itchiness, but in general the side effects of Redensyl are very less. Now, the ease of use. Both Minoxidil and Finasteride are available in the tablet and solution form. Minoxidil solution is US FDA approved, tablet is not. Finasteride tablet is FDA approved, solution is not. But nowadays, a solution of combined Minoxidil and Finasteride is of much rampant use, and by experience we have seen that it gives good results. Redensyl also is easily available in a solution form, and therefore the ease of use as a solution is good. Now, who should use? For Minoxidil, it is advisable that you consult a doctor before you actually opt for Minoxidil. For Finasteride, it is mandatory that you consult your doctor before you opt for Finasteride. For Redensyl, you can actually start using Redensyl at home at your own free will as you feel like. Later on, you can go to your doctor and tell them that I've been using Redensyl and these are the results of Redensyl, if you're not feeling any itching or flakiness or so. Now, coming to the cost of these medications. If you take tablet of Finasteride, it will cost you around 400 to 500 rupees per month. If you take a combination of Minoxidil and Finasteride solution, it will cost you around 600 to 1500 per month. Minoxidil alone will cost you around the same per month, and Redensyl again 600 to 1500 per month. If you want to ask anything regarding your hair transplant, you can ask in the comment section below, or if you want to show your pictures regarding your hair loss treatment, you can call us on these numbers or send your pictures on these WhatsApp numbers. As I had suggested earlier in the video, if you want to know more about Finasteride, as a Finasteride guide, you should click the video on the left, and for best hair loss treatment for men and women, you can click the video on the right.